Welcome to Health Talk. This is John King. Peter's not here today, but we do have a special guest in studio. Dr. Kristin Anderson is on the show. She's the Employee Health Medical Director for Community Medical Center, and she also works in post-acute care services for community physician group patients that need care after a hospital or for a transitional stay to a different home or for long-term care. And today we're going to be speaking about how you deal with aging in Missoula. So Dr. Anderson, tell us a little bit about what sort of care do you give or what sort of expectations do you manage that those facilities don't do on their own?
Well, it's more, we really try to go to a collaborative approach with the facilities, and we are excited to be welcomed into their world. It's sort of duties as assigned. You'll see lots of reasons why people go into nursing homes or long-term care facilities. For some people, it's just a stop-off. They have had a hip replacement, for example, and they're not ready to go home. They need some help. They need rehab, and it's not something that they really can succeed and fly at home. So they stay at a nursing care facility for a while, and we take care of their needs. We take care of their blood pressure or whatever needs they might have while they're there.
So do you find that you're kind of always managing surprise, like no one expects to ever end up there, but everyone does, sort of situations?
You know, that's a really good question. I think there are some people that are really prepared for that outcome. I think there are some people that think, this is the right place for me to be, and I'm not stressed about being here. And for others, it's a tremendous loss of their independence and really a difficult moment for them.
Do you work, in addition to the patients themselves, do you work with the families in terms of helping them through this transition? Because as part of that, I know it's got to be also very stressful on the families too.
Absolutely. That's probably, in some ways, I liken it to pediatrics, where as much as we take care of the small children and the infants, we're taking care of the families too. And we do many similar things in the nursing homes. And I would say that the facilities do a tremendous job of involving the families. And the more family help that we have, the better off that we are. And I think that's just an enormous topic. And, it's a tremendous stress to go through that on everybody and to be able to talk to a group of people. And, there's a real team on the ground in the nursing homes in terms of nurses that are familiar with what's going on, social workers, care managers. There's really a team there that may be behind the scenes that people don't know about. And I think that can be a source of reassurance for people that even if they don't know all the right questions to ask or even where to begin, that there's a team behind them that's really trying to help.
So when do people first come into contact with you? Is it something they set up through the hospital, or when they go to the hospital for the regular care they meet you, or how do you come into the picture?
Well, that's a great question. A lot of people, and we're happy to have that, they have an established relationship with a primary care physician here in town. And, studies show that if you have a primary care physician that knows your care, then you're likely to be better off. But as things have sort of evolved and developed, it's as you may know, it's hard for the primary care physician to get to the nursing home. It's difficult for them to get over there. So what has happened at Community, and it's really, I think, working pretty nicely because of the collaborative effort that everybody has, is that I walk in as a part of their team. So I say that I work with their primary care provider. We use the same medical record, for example. So if they saw their primary care provider just a few days before they went into the hospital, I can look through their records and see what happened. And then I can also convey back to the primary care provider once they go home, here's what happened in the nursing home. I've adjusted this. I've taken this off. And they know, so that hopefully some of those transitions of care that can be really challenging aren't so much of a problem.
It sounds like you deal a lot with people that are moving from one location to another. Do you find that communication between all these different organizations, does it usually run pretty smoothly, or is that part of your job?
Well, I had a professor that told me there was no such thing as true communication, and I think about that a lot. I would say that we do the very best that we can to try to assist with that communication. But back to your question about the family, sometimes there can be family members that often there's somebody here in town that helps and then there are family members that are in other places too.
I see. So, you guys use digital records, right, at
Correct.
Community?
Correct.
So, do all the other facilities use them, and is that something you can share with each other, or not?
In this age of technology, not only do we have a medical record, we have more than one because different facilities use different ones. But luckily, we're able to move pretty easily through all of them. And it's not, the traditional railroad tracks where, we wanted all the railroad tracks to be the same width so everybody could travel on the same tracks, even though they were from different companies. That's not quite where we are yet, but we are able to navigate all of them.
And it's streamlining, in other words, basically.
Right.
The one of the things that we've been watching, in other stories, is the baby boom mushroom cloud of aging that's apparently going on right now. Our average age in Montana is growing up rapidly. Less younger people, more older people. Is that something you're seeing directly in Missoula?
Absolutely. In fact, I'm glad that you brought that up. There are some statistics we learned from Missoula Aging Services, for example, that by 2025, Montana will rank 5th for having a population that's over 65.
5th in all
Correct.
the states. Wow.
That's the prediction. So, it kind of makes sense. A lot of people have left Montana and they go somewhere else and realize, oh, gee, I want to go back there, or I have family there, or
we're definitely getting older in the state, which has challenges. To John's question, when you look at just the demographics in the U.S., this is happening all over the world. Europe, China, places that you don't even imagine. Do you have any collaboration with peers, not just domestically, but internationally, in terms of looking at what they're doing that maybe is different or assisting the growing population in a manner that you could possibly adapt over here?
Well, I think that's a great question and goes to how different cultures see aging and death. And there are a lot of wonderful books out there. Atul Gawande, for example, has a great book about that. But I think, it's that gets at the heart of what aging means to us, and that really how it works in your family and what conversations you've had. I think this country in years past has really moved to a medicalization of aging that doesn't exist in other places. And I would say that a lot of people, see that as a huge difference, and in some ways we need to sort of embrace how other cultures look at that.
Can you give examples of how these other cultures may embrace it? Because for us, we don't want to get old. We do everything we can to stay young in every way possible, which means we wind up in the ER a lot more because we're a lot more physically active today, too.
I think that's true. And I think one of the important things to think about is that it's so important to have a conversation with your family about what you want. I think the data shows that many people don't actually get the care that they want at the end of life, but they get the care that their family thinks that they need to have.
All right. Hey, we got to go to a quick break. We'll be back to talk about aging and all of your questions. Give us a call at 721-1290. If you have a question, I'm sure that Dr. Kristin Anderson will be able to answer the question for you. I don't know. I'm totally ignorant on this whole aging process thing. All right, we're back on the Talk Back Show. This is John King. I've got Bob Seidenschwartz helping me out with Health Talk today, and Talk Back as well. And leading the front here, we've got Dr. Kristin Anderson. And you were mentioning at the end of the last segment just about the types of care you deliver. Mm-hmm. You go to the different elder care facilities throughout town. What sort of facilities do you not go to, or do you go into people's homes if they request help, or do you that sort of thing, or?
It's a great question. There are a few group homes that we go into. It's more of the exception than the rule, just because of the way healthcare is structured right now. There are things that can sort of happen in the clinic that are difficult to replicate at home. But with that said, there are team members, nurses and things that do go into the home. I will say that it is, when I have had what I would call the opportunity and the wonderful experience of going into someone's home, I learned so much about the patient, and it's so different than somebody coming into the office where I see them for just a few minutes. They've come in their car, they've probably dressed for the occasion. Whereas if you go home, it's a much different environment. You see, if they say in the office, yes, I'm taking all my medications, but you go into the home and see that, they aren't organized.
Right.
We can
Right.
that's an opportunity for intervention.
Right.
I'm not organized already, so I could use some intervention myself. When it comes to the different facilities, you've been able to see many of them firsthand. You know what kind of abilities the different facilities have, what they might specialize in. So do you have a unique position to counsel someone that might be choosing one of these facilities that has special needs or wants certain services?
That is a great question, and I would encourage people to go and visit, and I would encourage people to go and visit early and, get a sense of what's right for them, because each facility has its own personality, and what's right for one person and may feel comfortable may not for someone else. It doesn't make them, there's no value judgment applied to it. It's just kind of what they are.
So what I hear, though, too, is you're asking this aging population to face their mortality. So when you're saying go visit the facilities, it's not like taking a vacation
Right.
where it's like I'm heading to Europe for a couple of weeks. You're saying I want you to visit these facilities because in reality, there's a very good chance that you're going to wind up in some capacity. So how do you make that kind of psychological transition from your standpoint as a professional to say exactly what you just mentioned?
Well, I think that's a great question. It goes back to your earlier question about how different cultures
Right.
see aging and death. In other cultures, aging is something that's normal. They don't rage against it necessarily the way that people do here. Often there are family members in the home. Homes are built to include 3 generations or more. And sometimes there is that here in the United States, but I would say often the norm is to go to a facility. And so if that is a more comfortable option, then we need to really address that and have those difficult conversations. What I see often, those difficult conversations come from usually an adult child, perhaps a part of a larger family that's able to say, you know what, I see some things changing. You've left your keys in the wrong place and you didn't realize it. But that's a tremendous conversation to have,
Right.
and one that's important to have early, because it's so much easier when that person that you love is able to have that conversation with you, instead of if they're at a point where they're not able to. And that's what I tell people all the time, that none of us know. Driving
Right.
home, something
Right.
can change. So it's just critical to share with your loved ones what it is that you would want.
So do you help them stage these interventions?
We certainly can.
Mom, you're old.
Got it.
That's going to be a tough one, let me tell you.
Hey, John, I went through that several months ago, and it's not easy
It's not.
to
It's
sit
not.
down with a parent because it's giving up of so much of who they are and their independence.
Well, you had mentioned that, lost keys, things like that. Like, my mom has done that since I was a kid.
Sure.
So, like, how do you know when is the right time?
Today is the right time to do that, because none of us know. And it is a difficult conversation to have. But again, what I see, and as a preventive medicine physician that I see, is that you want to prevent stress or difficult outcomes that can be prevented.
Right.
And many times the parents have already thought about this, but they're scared to bring it up. You're still their baby.
Yes, exactly.
And they don't want to lose that independence. So driving, for example, is a tremendous loss of independence. That's a very difficult conversation to have. And very rarely is it somebody who says, you know what, this isn't okay for
Hey,
me
half the
anymore.
state of Florida shouldn't be driving, and giving up that independence, though,
Right.
is just...
Or voting after the last
Right.
primary,
Right.
as far as I'm concerned. Don't want to go there, though. So when we're talking about the driving aspect, and these other, when it comes to parents and children, there's obviously this big, oftentimes I would say, a big divide. Like, it's really hard for children to receive parental advice from their parents sometimes when they get old, and it's often really hard for the parents to receive advice from their children.
That's right.
Because you're doing this role reversal.
That's right.
So is it possible to get like someone from your staff to kind of help communicate, to be the authority, the voice of authority on a discussion like that?
Well, we do see that. We'll get many generations in a room, and that is a conversation that we have. Interestingly, I think also attorneys are often in that position.
And that's something in my profession I deal with all the time
Okay,
in
right.
terms of not just what you're describing, but really end-of-life decisions
Right.
about how are you going to dispose of your assets?
That's right.
What's the form of ownership? What are the implications of that? And I've got some crazy stories, last minute, things being done when somebody's, about to check out.
That's right.
Yeah.
That's right. So we can certainly help navigate those conversations. And they're difficult ones to have, but I think a recognition of understanding from everyone is important.
Right.
So you had mentioned attorneys. How much of what you work with is kind of based in the legal system, right? Because I assume there's, do not resuscitate orders. There's all kinds of other stuff people might have in their background or have worked out. So if they get to a place where they can't speak on their own behalf, or they may have lost the ability to speak clearly, that you could acknowledge what they had wanted at least before that tragedy had happened. So
right, I think the opportunity for the parents in that situation and whatever stage that they are is to try to, the term that we often use is get your affairs in order. Well, what does that mean? You don't have to know what that means. There are a team of people out there that can help you do that. Attorneys can help with establishing the power of attorney. And there are different roles in the power of attorney, and many people, want to get that sorted out. I can say that a really important ticket that helps in the critical situations and when someone is ill or a tragedy has happened is to establish one person in the family that's sort of the family spokesperson. If there's a large extended family, and you've got people spread out all over the country, it really helps to have one person that can say, well, you know what, this is what we talked about 5 years ago at the kitchen table. This is what Mom wanted. And
She wanted
this
to
is
give everything to me. You're cut out of the
I was
will.
going to say that I've heard this
and I heard her
horror
say
story
that. She
before.
wrote it down.
on June 11th.
Right.
So yeah, how do you work with that side of things, like the sibling
Yep.
back and forth?
Oh, absolutely. And we also help people fill out those orders. I mean, these are things that are going to happen. We can pretend that it won't ever, and the strategy can be to never get sick. But, there are only a few guarantees in life.
To my three sisters, wherever you're living, I'm right because you're not here. Well, we're coming back after this quick break with more from Health Talk and Dr. Kristin Anderson. All right, we're back on the Health Talk show. And before we run out of time here, I wanted to give you a chance, Dr. Anderson, to kind of give people an idea. I mean, we've talked a lot about talking, communicating, finding out what's going to happen or what we want to happen as we get older. Where's a good point of contact for people to go to if they're listening to this and they feel like they need to go do that right now?
Right. Well, if you need to do that right now, there are actually a lot of resources here in Missoula. Number one, I would say, is to talk to your doctor. Talk to your primary care doctor, or attend a visit, if that's okay, with your parents at a primary care doc's office, and say, I'm concerned about this. What do I need to know? And again, that behind the scenes team, there are social workers both working in the clinics where you would go, in the hospital, in these facilities, absolutely wonderful people that are in the trenches doing everything they can to help anticipate all these questions and have a tremendous amount of answer.
Okay, cool. Is there a phone number or a website they can go to?
The main number certainly is 728-4100 at Community, or you can also go online to communitymed.org. And then there are also other resources. I would just encourage people to make sure that if you're surfing online, be aware that you're finding trusted resources.
So, Dr. Anderson, this sounds like all the demands on your time and all your ancillary, support people. Do you have enough personnel out there across all the spectrum of services to meet this demand of this growing population?
I would say that's a huge issue in the medical profession right now, and we could probably do a whole nother talk on that, because a lot of times you're finding that, we just went through match day, and that's when residents match to the medical students match to their residency, and it's not always the number one match, you might imagine, to go into geriatrics or primary care. But, as we talked about before, Montana and everywhere else in the nation is going to be at that forefront. And people follow their heart into geriatrics, into primary care. And I would say that if you have any interest in that you're certainly not only going to find job opportunities, but also a lot of job satisfaction.
Do you find things are changing a lot in your field? is it rapidly changing?
I would say that, we've sort of seen this in the clinic sort of come a little bit. It might be that boiling frog in the, or, pot in the water.
Sure.
Because it's happening to us, and you certainly see an aging population come into your office, but it's only going to become more so. But the medical profession is ready and willing and able to try to address this.
All right. Well, one more time, why don't you give us the number for community?
You bet. Main line is 728-4100, and it's at communitymed.org.
Well, that was our time with Dr. Kristin Anderson and the folks over at Community. Thanks so much for coming in and sharing your knowledge with us. I will save this one. It'll be on permanent file. When Peter gets in, I'll have him listen to this. So I think it's important that everybody gets an education.
Peter is not that old, John.